Cancer is one of the most common diagnoses in the world. Statistically, 1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer at some point in their lifetime. And yet, despite how common cancer is, most people are never truly taught what cancer actually is, how treatments really work, or why the experience can be so different from one person to another. Many patients leave the doctor's office with more questions than answers. Why did the treatment work for someone else, but not for me? Why did the tumor shrink but not disappear? Why are the side effects so intense? And most importantly, why does cancer treatment feel so complex and uncertain? In this video, we will calmly and clearly explain the real science behind cancer treatment, in simple language, without fear, without exaggeration, and without false promises. This is not about miracles. This is about understanding what is happening inside the body, why modern medicine works the way it does, and why there is real reason for cautious hope. What cancer really is. At its most basic level, cancer is not one disease. Cancer is a group of more than 200 different diseases, all sharing one core problem: a loss of normal cellular control. The human body is made of trillions of cells, and every one of them follows a strict set of instructions. These instructions tell cells when to grow, when to divide, when to repair damage, and when to die. This process is incredibly precise and tightly regulated. Cancer begins when certain cells acquire genetic damage that allows them to ignore these normal control signals. Instead of stopping when they should, these cells continue to grow and divide. Over time, they can form a mass of abnormal cells known as a tumor. Not all tumors are cancerous. Benign tumors grow, but do not invade surrounding tissue. Cancer is defined as a malignant tumor, meaning it has the ability to invade nearby tissues and, in some cases, spread to distant parts of the body through the blood or lymphatic system. This spreading process is known as metastasis, and it is what makes cancer potentially life-threatening. Why cancer can occur? Anywhere in the body, cancer can develop in almost any part of the body because cells exist everywhere. Each type of cell has a specific role, whether it is producing hormones, absorbing nutrients, or protecting against infection. In women, breast cancer is the most commonly diagnosed cancer. In men, prostate cancer is the most common. In both men and women, lung cancer and colorectal cancer are among the leading causes of cancer-related death worldwide. However, it is important to understand that even when 2 people are diagnosed with the same type of cancer, such as breast cancer or lung cancer, their diseases are often biologically very different. Cancer is not just defined by where it starts, but by the genetic and molecular characteristics of the cancer cells themselves. Why every cancer is different. One of the least explained but most important truths about cancer is this: no 2 cancers are exactly the same, even within the same organ. A lung tumor in one person may respond very well to treatment, while a lung tumor in another person may behave aggressively. This difference exists because cancer cells accumulate different genetic mutations over time. These mutations influence how fast the cancer grows, how it interacts with the immune system, and how it responds to treatment. Even within a single tumor, there can be multiple subtypes of cancer cells. Some cells may be sensitive to chemotherapy, while others are more resistant. This is one reason why a tumor may shrink significantly, but not disappear completely after treatment. What doctors mean by cancer stage. When a cancer diagnosis is made, one of the first questions doctors ask is, what stage is the cancer? Staging refers to how large the tumor is, whether it has spread to nearby lymph nodes, whether it has spread to distant organs. Early-stage cancers are usually localized and easier to treat. Advanced stage cancers may involve metastasis, and require more complex treatment strategies. Staging helps guide treatment decisions, but it does not tell the full story. Two patients with the same cancer stage may still have very different outcomes based on tumor biology and overall health. The three main cancer treatments. Despite all the complexity, most cancer treatments still rely on three main approaches: surgery, radiation therapy, and chemotherapy. Surgery works by physically removing as much of the tumor as possible. When cancer is detected early and confined to one area, surgery can sometimes be curative. Radiation therapy uses high-energy beams to damage the DNA of cancer cells, preventing them from dividing. Radiation is localized, meaning it targets a specific area of the body. Chemotherapy uses drugs that circulate through the bloodstream to kill rapidly dividing cells. Because cancer cells divide more quickly than most normal cells, chemotherapy can be effective. But it also affects healthy cells that divide quickly, such as those in the hair follicles, digestive system, and bone marrow. Why chemotherapy has side effects? Chemotherapy is often misunderstood. It does not target cancer cells perfectly. Instead, it targets rapid cell division, which is a key feature of cancer. Unfortunately, some healthy cells also divide rapidly, which explains common side effects such as fatigue, nausea, hair loss, and lowered immunity. Doctors carefully calculate chemotherapy doses to maximize cancer cell death while minimizing harm to normal cells. This balance is one of the greatest challenges in oncology. Side effects do not mean the treatment is failing. They reflect the powerful biological effects of these drugs. Why cancer sometimes comes back? One of the most difficult realities for patients is cancer recurrence. Even when a tumor shrinks dramatically, small populations of resistant cancer cells may survive. These cells can remain dormant for months or even years before becoming active again. This is not because treatment failed completely, but because cancer is adaptive and genetically diverse. Understanding this has led to the development of combination therapies and long-term monitoring strategies. Why treatment is often combined? Because cancer is so complex, doctors often use multiple treatments together. Surgery may remove most of the tumor, radiation may target remaining local cells, and chemotherapy may address microscopic cancer cells that cannot be seen on scans. This multi-step approach improves survival rates and reduces the chance of recurrence. It also explains why cancer treatment plans can feel overwhelming. Each component serves a specific scientific purpose. Integrative oncology. Treating the whole person. Modern cancer care increasingly recognizes that treating cancer is not just about destroying tumor cells. Integrative oncology combines conventional cancer treatments with supportive therapies such as nutrition counseling, physical therapy, psychological support, and stress reduction techniques. Managing pain, fatigue, anxiety, and depression is not optional. It is essential. Quality of life plays a significant role in how well patients tolerate treatment and recover afterward. Nutrition and cancer. What science actually says. Nutrition does not cure cancer, but it plays an important supportive role. Adequate protein intake helps maintain muscle mass. Balanced nutrition supports immune function and helps patients recover from treatment. There is no single anti-cancer diet, but research supports diets rich in whole foods, vegetables, fruits, healthy fats, and adequate calories, especially during treatment. Extreme dietary restrictions without medical supervision can be harmful. Intermittent fasting, a cautious, scientific area. Intermittent fasting has gained attention in cancer research, particularly in laboratory and early clinical studies. Some research suggests fasting may help protect healthy cells during chemotherapy, but this area is still being actively studied. Fasting is not appropriate for all patients, especially those who are underweight, frail, or undergoing intensive treatment. Any fasting approach should only be considered under medical supervision. Precision medicine and genomic profiling. One of the most promising advances in cancer treatment is precision medicine. By analyzing the genetic makeup of a tumor, doctors can sometimes identify specific mutations that can be targeted with specialized drugs. This approach allows for more personalized treatment and, in some cases, fewer side effects. While not all patients benefit from precision therapies, the field continues to grow rapidly and offers real hope for the future. Why this is a time of real progress. Today is one of the most exciting periods in the history of cancer treatment. Advances in immunotherapy, targeted therapy, and genomic profiling have already changed outcomes for many patients. Cancer is still a serious disease, but survival rates have improved significantly for many cancer types. Knowledge, research, and personalized care are moving medicine forward. A message of realistic hope. Hope does not come from ignoring reality. Hope comes from understanding it. When patients understand what cancer is, how treatment works, and why it is so individualized, fear often gives way to clarity. Cancer treatment is not simple, but it is more precise and compassionate than ever before. Education empowers patients to ask better questions, participate actively in their care, and make informed decisions. If you found this explanation helpful, please subscribe to this channel. Our goal is to provide calm, science-based, and compassionate education about cancer, without fear, without false promises, and without misinformation. We will continue to share expert insights, real medical explanations, and supportive content designed to help patients and families better understand their journey.